My persuasive speech is to persuade my audience that everyone should learn CPR, which is cardiopulmonary resuscitation. There are two good reasons everyone should learn CPR. CPR saves lives and is easy to learn. Picture this scenario. You are in a meeting when a manager across the conference room table puts his hands to his chest and mumbles that he thinks he's having a heart attack. He stands up, takes a step, and falls to the floor. The victim tells you he has a heart problem. He has heart problems before he lapses into unconsciousness. Before the paramedics arrive, you must administer CPR to an apparent heart attack victim who is no longer breathing. Time can be critical when it comes to performing CPR, and your training could save someone's life. Statistics say there are about 10,000 cardiac arrests in the workplace each year in the United States, according to a report from the U.S. Occupational Safety and Health Administration, also known as OSHA. Another example is picture a warehouse order picker has been pulling double duty for 2 days in a row. She's in a hurry to pick a product. She takes a shortcut, which causes an avalanche of heavy boxes to fall, pounding her on the way down. She falls to the floor, unconscious and bleeding. When you arrive on the scene, the victim is not breathing and bloody. You must follow steps to administer CPR to a victim who is injured, unconscious, and not breathing. What would you do? This is a scene where knowing CPR would be beneficial. According to 2014 data, nearly 45% of out-of-hospital cardiac arrest victims survived when bystander CPR was administered. Bystander CPR improves survival. This is according to the American Heart Association. CPR is easy to learn. One of the main reasons bystanders choose not to get involved is because people hesitate to perform mouth-to-mouth to a stranger. In 2010, the guidelines for CPR were changed, with revised guidelines saying that people who have no formal training or those who do not feel comfortable should attempt hands-only CPR. Hands-only CPR has been shown to be just as effective for many adult patients of cardiac arrest. CPR is easy to learn. It's a basic set of hand movements with some mouth-to-mouth if you're comfortable. You can do hands-only CPR, which eliminates the concern relating to infection. To perform hands-only CPR, you will begin by placing the heel of your hand on the center of the patient's chest. Place your other hand on top of the first, interlacing your fingers. Press down on the chest about 2 inches and release. You have to repeat this quickly at about 100 compressions a minute, and you will continue doing so until emergency services arrive. It's always a good idea to have another person assist you, if possible, to take over. Formal CPR is easily available at accredited schools across the U.S. The Red Cross is an excellent place for CPR training. And once you're trained and certified in CPR, you should continue to recertify every 2 years. The number one reason everyone should learn CPR is you could possibly save someone's life. Performing CPR helps preserve an individual's brain function during a cardiac arrest, increasing the chance of keeping their blood flowing and keeping them alive. The second reason is that you will be more valuable to your community, because the more people that take the time to be trained, the better the chances are that you will be able to save someone's life. So please consider taking a certification course in CPR or a CPR certification course. This is my CPR certification. I don't know if you can see it, but I'm due to be recertified again in March of next year. We do a certification course at work here like every 2 years.